Hi everyone, my name is Dr. Prashanth Arun, consultant physician and diabetologist at MV Hospital for Diabetes, Roypuram. So we get a very common question asked by people always, that is, one is whether insulin is needed. Next is, maybe we can push the insulin, can we take it a little later, or do I take insulin now itself, and now that does that really mean that you have reached a critical stage of diabetes, or if I start taking insulin now, do I really need to continue it lifelong? So there are so many doubts, that questions that come out when we say insulin to a patient. But first you need to know what this insulin is. So insulin is a hormone that is produced by your pancreas, the beta cells in the pancreas, and the work of this insulin is actually to take the glucose from your blood into the cell. So when suddenly somebody is telling you that you have to take insulin, which means it is not that you have to take it lifelong. For some people, maybe if you give insulin for a very short duration and their sugars are normal, we can actually change them back to their tablets. Number two, so when do we actually say that a person needs insulin? Maybe if your HbA1c is more than 9, or say your sugars, your fasting blood sugar itself is more than 200, or your sugars are generally about 300, it is always better that you start on insulin, bring down your sugar, and then change to tablets if possible. And whenever we start insulin early, that is early insulin, we can actually try and stop your insulin and change you to tablet. But when it becomes longer, because many people say once insulin is started, I've seen people take it for lifelong. But that is when you start insulin at the later stages, that is when you don't accept to the doctor to give you insulin, we'll be pushing and not starting insulin, which will actually, all the beta cells will be finished. So once your beta cells are completely depleted, then definitely we'll have to continue insulin lifelong. So if you want to preserve your beta cell and protect your beta cell function, it is always better you start insulin on a earlier stages. And what are the precautions to be taking when you are taking insulin? So if you are taking insulin, it is always better that you split your meals and take, to avoid hypoglycemia, and regularly check sugar at home. So when I tell regularly check sugar at home, you can buy a glucometer and you can check your sugar fasting, postprandial, that is before food, after food in the morning, before food, after food in the lunch time, and maybe before and after even your dinner time. So in this we will get to know where your sugar is going up, and accordingly we can put you on that type of insulin, because we have the long acting insulins and we've got the short acting insulins. So the short acting insulins will work on your after food blood sugars, and these long acting insulins work on your before food blood sugars. So depending on where your sugar is going up, it will be helpful for the doctor to choose you on insulin. So definitely insulin is not of any harm, and taking insulin is actually good, that you can control your blood sugar and avoid your complications due to diabetes like the diabetic retinopathy, nephropathy, neuropathy, etc. Thank you.